No, you just talk about that, and it's just so unfortunate that the society is just so divisive of how your body works. Mm-hmm. It's like, what do you mean? What do you mean my GI system is related to my stress? There's no relationship. Or what do you mean my shoulders or my hand hurts and I'm have this debilitating numbing tingling because like I'm eating like crap.
Yeah.
Like it's so
disconnected.
So disconnected.
Well, it's convenient to keep it disconnected because then you have to face your freaking problems usually.
Seriously.
Right?
However, I think it's bigger than that in that we foundationally have a disease care versus a healthcare system and an education system training doctors,
100%.
medical doctors, that you can't get better. Like it is foundationally so broken at the educational level, and then the residencies and the hospitals, and then as a society, you don't get PSAs on your immune system, and you get drug ads, and that is a bigger. It's much bigger than us.
Oh yeah, systemic is
I think
correct.
Systemic.
Yeah, I think the current events in the last few years have opened the eyes to a lot of alternative options. But it's like you said, foundationally and on the education level, it's like you visit a doctor and they say like this is what you can do, and if they're not open to alternative medicine, it kind of gets pooed on pretty quickly. So,
which I always think too is funny because we call ourselves alternative, but we are the medicine and the healthcare.
Yeah,
right.
It's backwards. Like in my mind, it's backwards.
Right, healthcare versus sick care.
It's healthcare care versus sick care.
Right.
Is it more harmful of a title than it is helpful? Because it should be the norm.
I like alternative just because there's. I don't know. I like the context or the.
It is the alternative. I mean, I think it depends on how you want to phrase it. It can be harmful. Like it can be used in a negative connotation, like, you're going to an alternative medicine provider, right? Like, I think like depending on your intent, but it is the alternative. It's the choice in the alternative versus traditional allopathic medicine.
Right.
So it can be really, really positive. Like, oh my gosh, yeah, we're alternative medicine providers. It's amazing.
You're not a doctor. Nope, I'm a chiropractor.
Right.
Yeah.
Let's move on.
Well, it reminds me of the quote of if you have Western society diet, you have Western society medications, like expect Western society diseases.
Right.
Like, sure, you can do that. You can follow all of these things. That's like the society norm and not alternative, but have the expectation that you're going to have the same stuff the rest of the society has. Heart disease, right? Number one, you're going to be, what's number 3 top of the list for deaths, medical deaths?
Well, mismedication.
Mismedication, right? So if you have that expectation that you're probably going to have the same things, then sure, go downstream, down mainstream terms instead of alternative.
Right. We are taught as a society that any response of getting sick is bad. But that's not actually what it is.
Say more about that. That's fascinating.
Body doing its job.
Yep.
Your body is doing its job.
Right.
So when you get a fever, not comfortable, not ideal, can be dangerous if it's like, consistent 104, 106, over time, right? It can cause dangerous problems. However, when our body creates a fever, it is doing it to kill off the pathogens in your body. It's genius, right?
Yep.
Like that piece of like, oh, I have a runny nose. Well, yeah, because you're trying to expel the problem factor.
I love that. I
So
think
we keep suppressing it.
Yeah. Right.
Yeah.
And it's like, well, but your body's
I have
telling you something.
Right. Oh, I have a cough or I have a sneeze and I have a runny nose and I have a fever. And it's like, sweet.
Yeah.
Even like
great.
loose stools and diarrhea, like, right? Like your body's trying to tell you, or puking. I mean, it's trying to get the toxins out.
Right.
Like,
It's your body communicating something to you.
right.
And some people are numb to that. It's like, oh, this is happening.
Right.
It's like, pause and think about
Why
it.
do I feel
Yeah.
terrible?
Right.
Yeah. When patients are sick, unless they're like puking and, or it's
Gross.
like coming out both ends, right? Then maybe stay home from a sanitation perspective. However, otherwise, I mean, you have cold, flu, just come in and get adjusted. Like come in and get your nutrients so that your body can heal faster. Because as we talked about before, if you need to be adjusted, that disruption to your nervous system is going to decrease your immune function because it impacts your internal organs.
What are some easy things for folks to just be doing and taking We touched on like the vagus nerve, like,
Yeah.
manage your stress a little differently.
Manage your stress.
I mean, stress is huge. Of
Work
course.
on sleep, right? Like
Limit sugar.
Limit sugar. Yeah. If your blood sugar when your blood sugar goes over 120, like spikes up too high, it decreases your immune system response by, I think, like 75, 70, 80%. Like massively.
Yeah.
And think of how many people are addicted to sugar. Well, it's delicious. It's, they did a mouse rat study years ago.
Oh, yeah.
And
Cocaine.
Yes, more addicting than cocaine.
Really?
Yeah.
I would. No, never mind.
More addicting than cocaine.
I'm not going to test
Probably.
it out now.
All
By
right.
theory.
Okay, so if you're in that spiral, like just make better choices of higher good quality fats and protein. Like your body is craving that sugar and that drive because it's exhausted. So like what is it? It's trying to tell you something when you're addicted to that, for sure.
Yeah.
And then like some good exercise and movement, sleep is super important.
Well, from that book, Why We Sleep, if you ever read that.
I've not read that.
I forgot the guy.
Why do we sleep?
Matthew something.
Mm-hmm.
Anyways, he talks about like
Yes.
if you get less than, I think it was like less than 5 or 4 hours of sleep, it decreases your immune function by like 40 to 60%.
At least, yeah,
something like
sure.
that. So same thing. So you add on top of, if you're lacking in sleep, you crave carbs much more.
Right, because you need
right?
the quick
so
energy.
like, yeah, you need the
You
quick
get caught in
energy.
a spiral.
If you ever noticed that. It's just,
Well, and it's interesting because, and we haven't talked about like gut health yet, right? But
Right.
our gut health is super important for making the right brain neurotransmitters and having good, happy, healthy brain chemistry for our skin, for our immune response, for allergies, skin, all of those things, absorption of nutrients. And people can get a leaky gut very easily. And like a leaky gut, your immune system in your small intestine, you have they're supposed to tight junctions, right? The cells are supposed to be close together. And then you have these little microvilli where you absorb your nutrients. And if that's out of balance, it's basically like like our last winter. It froze and then it rained and then it froze and the potholes were out of control. And that can happen inside you. So then you're not absorbing your nutrients. You're not feeling as good. So that's the purpose of why we make different choices with nutrients to help heal your lining, to boost your immune function, to be more supportive in that way. One of the things with sleep is your melatonin is made in your gut mostly. So sleep can sometimes be a gut problem, and blue light will deplete melatonin.
where does blue light come from?
Yeah, I mean, we don't
never
know about
around
that
any.
at all, right?
Never heard of her.
So,
Shit's up
like
here.
the glasses, that's why we say get off your devices before bed, like that kind of stuff. The medical world is trained to think of things as like black and white. This blood test is off, you need to take this. This is off. And that's not how health works.
It's not how your body works.
It's not how your body works. However, there's always exceptions to the rule. And with omega-3 and vitamin D, if you're low, you just have to take it. And omega-3s, we can't make them. We literally have to take them either by eating fish, which now we've poisoned our ocean, so we can't eat fish every day, or you have to take a good quality omega-3 supplement.
Also, I was reading something. I kind of remember this from school too. But don't you also need magnesium to help absorption of vitamin D?
Yeah.
It's a
Right.
cofactor of some kind.
Yeah. Magnesium
It's like
is
it's
a
like
super
an
huge
enzyme of-
cofactor of everything.
Right. I mean, magnesium's huge. I mean, we tell
Yeah.
people all the time, like,
Everybody needs
I don't know.
magnesium.
yeah, do I need magnesium? Yes.
Yes. Magnesium is depleted, one of the first nutrients massively depleted with stress.
Right.
So we think of magnesium as just of like, oh my gosh, my tight
Yeah.
muscles and recovery, but it's also necessary for your hormone function, brain function.
Like everything.
Yeah. And like this, if people ever get bumps here, 90+% of the time, that's omega-3 deficiency.
I feel like you always have those bumps.
And if you're taking a good quality
ones?
omega-3 and it does
good
not
to zoom in.
improve.
How big are these
Oh
bumps?
yeah, not those bumps. Not those bumps.
I need more omega 3s.
But they will build with omega-3s because it helps with muscle recovery and decreased inflammation.
Wow.